We've made so much progress since the beginning of the pandemic. We were able to all come together to really work as a team to make sure that we had the resources that were necessary to really help our patients and to help each other.
The year 2020 is extraordinary for everyone, and we cannot forget it. COVID-19 brings us a lot of sadness and misfortune, but also gives us a lot of heart-touching moments. I'm really proud to be a physician.
When it comes to COVID, there's one patient that really stands out, and it was a 3-year-old who had a heart transplant, and she was diagnosed in early March with COVID. The great news is that she bounced back from this. She had some antibodies that developed against her heart, but we were able to treat those and those eventually went away. It was scary, but it was also one of those things where we're gonna get through this. The thing that brings me joy is the interaction with my patients and the ability to see somebody like that 3-year-old go home.
There's never been a better time to practice cardiology. We're developing tools that allow us to improve patient outcomes in ways that were not dreamt of when I entered the profession. What the pandemic period has really brought to light is the health inequities. And I think that we must strive as a society, as a profession, as a college, and as individuals to do everything that we can to provide equitable access to all of these advances to all segments of our society.
When we think about health equity, when we think about calling out systemic racism, I'm hopeful that those changes are going to continue on through 2021 and beyond.
There's a lot of data showing that African Americans in the city of Baltimore were not getting vaccinated at the same rate as white residents. So Ascension St. Agnes partnered with Central Baptist Church. We would do the Q&A, it would go out on Facebook Live, and then we would vaccinate the faith leaders. And so I got to be on the team that was going to come do the vaccination. We had 5 extra vaccines and the clock is ticking. So my colleagues go running across the street to a local hospital, to the emergency room, and saying, we've got vaccine, but you got to get over here. My colleague Naleen comes running in and snatches up that last syringe and the thermometer and goes running off down the street. Come to find out, there was a medical assistant who said, my mom would love to get the vaccine. She's 2 blocks away. She can't get there in 10 minutes. And Naleen said, well, I'm going to bring it to her. And so she ran down the street and with like 2 minutes to spare, got that vaccine given. So we didn't waste 1 drop of the vaccine that day.
I think ACC has been a really awesome home for cardiology. I've been fortunate enough to help to lead some of the educational sessions, and particularly in valvular heart disease, and really just to see the community come together for a common cause.
We can communicate, we can share our experience during the COVID-19 period.
The COVID hub was tremendous. We knew that we could go there and get all the information we needed. It provided a platform for really powerful advocacy, and having the community of colleagues that ACC helped me connect with was crucial.
We were all driven to come into medicine for various reasons, and I think there's a spark. And I think what this reminded me of is how much I love what I do and how much I appreciate every day that I get to do this.
We were just trying to provide care for our patients under strange circumstances, and I was incredibly impressed by the willingness of all of the healthcare professionals that I'm privileged to work with.